Welcome to this month's October Health Update. So I am your gentle facilitator. So I'll be simply admitting people in the room, but my name is James Barta. I'm with ODHS, Oregon Eligibility Partnership, doing community engagement and use he, him. But like I just mentioned, I am not the star of the show. I'm going to turn it over to our comms maestro, Sean McAnulty. So Sean, take it away.
Hello, my name is Sean McAnulty. I'm OHP's Member Communications Coordinator, and then we're going to be going through a few topics today, starting with the unwinding topic, as well as touching on normal renewals and outreach to the uninsured. Then Trissa from the waiver team is going to be joining us to talk about the housing benefit, followed by Katie and myself talking more about the OHP Bridge updates that we've got this month. Then at the end, we're going to have some open discussion time. One of the main purposes of this meeting is to try to get y'all some opportunity to ask questions you want to and have that discussion opportunity with the policy experts that the state has. So diving right into the unwinding side of things. Right now, we in October 2024 just hit that far right light blue category where we are basically in the wrap-up stages of the unwinding, cleaning up the renewals that have been sent out previously in that dark blue category. We had those 4 additional waves of renewals that were affected by the delay in the unwinding process, and then we are those are going through an extended. They have those extended response timelines, so we're waiting on those responses, and then are expecting those will be wrapped up by February 2025. At this point, we are 96.3% complete with all renewals, over 1.4 million renewals now complete, getting into that last 3.7%, which is currently with members. And then out of those, just under 82% of members have kept their same benefits. And about 1.7% of them have had a benefit reduction, which is usually going from OHP to a Medicare savings program only, or something else where they're keeping some form of medical benefits, but not the same one they had previously. We've seen that category increasing over the last couple months. There's about 6,600 added since last month and 4,600 in the previous month, which has been increasing significantly, especially due to the population that's going through renewals right now. Many of them are over 65, which makes them more likely to end up going to a different medical benefit rather than qualifying for OHP under the same thing. Once you qualify for Medicare at age 65, you get checked for eligibility for other programs based on whether you have that can potentially help pay for your Medicare as well. But we've been seeing that category increase. We've got a little bit more content about that group later on in the presentation. Then 16.7% have had their benefits end. There's been a bit of an increase there since last month, but it's not hugely out of proportion with what we've seen previously in the pandemic. It's really the benefit reductions group that we saw decrease when we restored benefits earlier in the pandemic to the people who are currently renewing. And then now that they're going back through renewal, we are seeing that number increase again back to around where it was. So given the population going through renewals right now is much more likely to be over 65, particularly, or have disability, we have got some additional outreach efforts we've got going on to try to reach this group, recognizing the extra priority there. So our call center support staff through PH Tech, one of the contractors that makes up our call center, they are calling members who have 30 or 60 days left in their renewal period who have one of the programs listed here. They're going through several different groups of people in order, but the first off is going to be the Oregon Supplemental Income Program members who have long-term services, then anyone with a Medicare savings program who's renewing right now, and then anyone who has OSIPM but not either long-term services or Medicare savings. So they're trying to get that additional reminder call out to these members. A lot of them are pending for interviews. That's been the most common request for information type. They're also trying to schedule those interviews with the eligibility worker during those calls if they're in that window there. And then many of these members will have long-term services and supports. It's more common than the general OHP population, at least. For those members that do have a case manager through their long-term services, we're having that case manager reach out to them as well and try to remind them about their renewals, schedule that interview with the eligibility worker as well, and remind them throughout that process. So that group may be doubled up on if they have a case manager as well, but we want to make sure we're pulling out all the stops to reach these folks. We're also sharing data with various partner organizations like the CCOs. This also extends to partners like yourself, though. If you're a community partner application assister and want lists of your associated clients that haven't responded or have terminated for non-response throughout the process, reach out to your regional outreach coordinator. We can get you lists like that. Related to that group of people who are losing full OHP and moving to a Medicare savings program only, we are about to head into Medicare open enrollment season, which is from October 15th to December 7th. During that time, you're going to see a lot of Medicare related messaging. This is the time when people can make their Medicare plan decisions for the year. This is also where we want to get the people who are losing coverage right now, if they have Medicare as well, or have just started Medicare. Anytime you're having one of those major changes and whatnot, it's a great idea to go get some Medicare choice counseling if you have Medicare and decide between those decisions. So if someone wants to know if the plan change in their OHP benefits means they should also sign up for a Medicare Advantage plan or something like that, that sort of question you would want to direct to a SHIBA counselor, a senior health insurance benefits assistance counselor. They're kind of similar to OHP assisters, but for this Medicare plan selection side of things. Or care insurance agent, either of them can help with that sort of thing. Referring them through the Get Help tool locator, the same way you can find OHP assisters, is a great way to get them the help they need. But we're going to see a lot of that coming up in the next few weeks with Medicare open enrollment season and the people losing coverage right now happening to be much more commonly Medicare savings program being their next coverage home. Otherwise, another big thing this month is that the normal non-pandemic renewal timelines are going to resume. So up until September, all of the pandemic unwinding renewals had extended renewal timelines, which included up to 90 days to respond and 60 days before closing benefits when we found you were ineligible or you didn't respond. So the renewals that are already started prior to September are going to still have those longer timelines. That'll continue through February 2025 for the last of those waves. And then the renewals starting in October going forward are going to return to normal timelines. I've got a chart on the next slide, but for the renewals starting this month, we send them in October. They would have until the end of November to respond, which is a full month plus all the time in October that we have additional. So it's about 6 weeks most of the time. And then after that, if they hadn't responded by the end of November, we would send them a termination letter with a 1-month time frame, ending benefits at the end of December. They can still respond up until the end of December to prevent closure. That doesn't change at all. Neither does the ability to get your case reopened via the reconsideration period if you respond within 90 days of your closure and are still eligible. So that when put up on the schedule here, we've got this chart of all those renewal dates that are upcoming. Our October wave has a renewal date in the system of the end of the year, which is going to be the same date as their end of coverage possibility. That's normally how they align. That has been out of sync for the pandemic unwinding, and it's going to be returning to normal there. So that's how the timelines line up for each of these waves. We want to reiterate that even if you don't respond by the reply by date and action is taken to close the case, if you respond after that, you can still keep your case going. That doesn't change at all. Please keep helping people respond to the renewals, even if that date has passed. But it'll ask for a response by the end of that month so we can make a decision on whether or not to keep their benefits going. Other news in the month was that the results of the Oregon Health Insurance Survey came out, which is how Oregon measures its uninsured rate. Great news out of that was that Oregon's uninsured rate is only 3%, or 97% of people have health coverage now. You can see on the right side of the screen, we have had a huge drop off since 2011 in the uninsured rate. It used to be nearly 15%, down to 3% now. For some groups, Latino specifically, it dropped from 27% down to 7.7%. So there's still some disparities there, but huge progress has been made over the last decade and change. In that time, we saw the huge drop on this graph driven by the Affordable Care Act in 2014. Since then, Oregon's also had a bunch of specific policies that have really driven this too. Healthier Oregon's got more than 90,000 people on it now that are eligible since the last 2021 study. We've also had OHP Bridge launch, which we've got some stats coming up on later. Unwinding's been quite successful in comparison to other states, keeping people covered. And then continuous eligibility has kept so far more than 60,000 people covered that would have lost benefits due to churn. When their income changes, they're able to keep their benefits for 2 years now. So there's a lot of steps Oregon has specifically taken to get here, and it's really great to see that we're having more people covered. The other side of that survey release is that it's got a really powerful data dashboard that has a bunch of demographic options that you can cross-reference with each other and whatnot. I've got a link here. We'll distribute the slides after the meeting as well, but the Oregon Health Insurance Survey dashboard does have a bunch of things like the regional uninsured rates. You see those on the right side of the screen, what the uninsured rate is in any specific region. We kind of notice a pattern there of many of the rural regions have higher uninsured rates, though the cities I've got, or the counties, the densely populated counties I've got listed on screen are still where the majority of uninsured physically are. So there's larger numbers in the populous areas, but higher rates in some of the urban or the rural ones that we're seeing on this map here. Other interesting data out of that, there's about 24,000 people who are uninsured and eligible for OHP based on their responses on income and things like that. Some of the demographic breakdowns of this data are fairly interesting. We do see that it's trending somewhat towards the young folks. 9,900 of the 19 to 34-year-olds was the largest group on age. We also see the largest group is employed, followed by some self-employed and unemployed and out of the labor force folks as well. Uninsured who are eligible for OHP also skewed pretty heavily male. In race ethnicity identification, they didn't have a whole lot of data that rose to the sample size large enough to be statistically useful, but for what we saw, we did see predominantly white and some Latino as a sizable group in there. And then across that whole group, one of the primary reasons for not applying was that they are not eligible and make too much money, despite some of their responses indicating that they probably do qualify for OHP based on income. All this data was collected in 2023 as well, before OHP Bridge launched. So that last answer probably has changed for a lot of those members, given OHP Bridge has higher income limits for members. So just wanted to highlight that as well as we got the results out of that study there. Alrighty, do we have any questions on the unwinding session before I hand over to Teresa, who will be presenting for us on housing? James, do we have anything in the chat?
Nothing in the chat.
Alrighty, Teresa, are you ready to present?
Yes, wonderful. Thank you, Sean.
Thanks so much.
Hey, everyone. Teresa Young White. My pronouns are she, her, hers. I am with the Oregon Health Authority, and I work on the health-related social needs benefit, which is new in 2024, and housing goes live on November 1st, which is what we're going to talk about today. Just as a quick reminder, if you want to go to the next slide here. Oh, I'm sorry. I thought it was a different slide. This is great, though. I mostly said that. I really wanted to say that the health-related social needs and housing eligibility is very complex. So feel free to reach out to folks here at the Oregon Health Authority, at your coordinated care organization. Myself, I'll put my email in the chat. I'm happy to help answer questions for you. So we're going to talk a little bit of an overview of the services, but just keep in mind that we have certain populations and certain folks that are eligible for this benefit. It's not all Oregon Health Plan members. The idea, and this is what was approved by the Centers for Medicare and Medicaid Services, or CMS, was to support folks going through major life transitions or that have gone through major life transitions in their life. And we'll talk a little bit more about what those populations are later in the presentation. The benefits that are available are climate, outreach and engagement, housing, and nutrition as of January 1st in 2025. So climate has been live for a few months now. We've seen a lot of members get support with air conditioners for extreme heat, with air filters in the smoky, wildfire regions in Oregon, and other climate equipment that can help. Outreach and engagement is a little bit of a behind the scenes benefit. It is not something members may necessarily know they're specifically receiving. It's very similar to activities around care coordination or case management for housing, and it's intertwined with that. So HRSN service providers, like I think probably a lot of you are maybe thinking about that are on the call, or potential service providers, or maybe you've already enrolled, can bill for these services, get paid for engaging with members for certain activities. We're not going to talk incredibly. Can you hear my dog, James, barking? Is that it?
Yes,
I'm so sorry.
that's fine.
Is it very distracting? I could try to get her to be quiet, but she's still a puppy. So,
I think you're fine. Keep going.
thanks. I don't mind being interrupted with questions. I usually preface a presentation, but like that, by the way. So if you have anything in the chat, I keep an eye on it and I'm happy to answer. Raise your hand, interrupt me, anything. I should say that anyway. So, so we're going to talk more about housing today, though. But if you'd like more information on how to be a service provider, on outreach and engagement, just really happy to talk with you about that. And like I said, I'll give you my email address. Housing, I'm going to skip on this slide because we're going to go into depth, but then nutrition going live on January 1st will be medically tailored meals and nutrition education for this upcoming January, by the way. Next slide, you're good. Thank you. So the goal for housing is to help people stay in their current housing. This is not for folks that are unhoused, so it's not for homeless folks. There are hopefully other resources that people can access there. This specific benefit is really working to be preventative and keep people from being evicted or becoming homeless for other reasons. We can go to the next slide, please. Thank you. So the specific actual housing supports, or the housing benefit, like we like to call it, is there is rent. There's rental for up to 6 months. There is utilities. If someone was approved for rent, they could also get approved for payment of utilities, which could be back payments. It also could be forward 6 months, but you could have 3 back payments or 3, forward payments, etc. And that could also include storage fees. So those bottom 3 are actually intertwined. So I want to be really clear. You have to be eligible for rental assistance to get storage fees or utility setups. The other 2 really big pieces of the housing benefit is this first one here. So tenancy sustaining services. Most people in the housing world will call that housing case management. So it's helping people prevent eviction by completing their paperwork, potentially connecting with resources to help them even keep a job, so they have a sustainable income to pay their rent. So they don't have to get the rental benefit for that. Sorry, she's going. It's just going to be what it is right now. So these housing services are really intended to support the member staying in their home. And that is a wide array of activities that can be supported and paid through this benefit, or covered through this benefit rather, for the members. The other piece of this is we call them home mods and remediations. It's kind of fancy language for changes or updates to the home that is linked to a member's health outcome. So if they needed the installation of a grab bar in their bathroom, right? If they needed a, I think colloquially it's called a muck out, but like a clean out of their house because it's impacting their health and they have a health condition that is inhibiting them from being able to clean out their house, for instance, and they need support with that. That also could cover some things like pest control, bed bug eradication, things like that. And then it also would include staying in a hotel or a motel while those repairs, modifications, or remediations are taking place. It says on the bottom here, but we just want to be really clear that for home modifications, well, for all of these benefits, they need to be tied to a health outcome. But for home modifications, it has to be tied to the health outcome that is impacted by this particular concern. So having a complex physical developmental disability and needing a grab bar, those would need to be connected there. So just making sure that when you talk to the health plan, and that's who you would be requesting services from, you try to connect those dots with them as well. And your coordinated care organizations in your region, or Open Card if you serve Oregon Health Authority or Oregon Health Plan, Open Card members should help with that process as well. But it is a way for you to be able to call up their health plan, the member's health plan rather, and say, hey, I need help with this. This member probably needs this, and then they will dig in. But the most you can do, the most information you can do ahead of time with the member is always really helpful for timeliness. I'm going to pop over to the questions really quick. Alma, yes. Every person eligible for health-related social needs, the very first thing is they must be a current active Oregon Health Plan member. Would these, Sherry, I apologize if I pronounce it wrong, would these be available for people living in an apartment for accessibility modifications? Absolutely. So people who own their own home may have a mortgage. They are eligible for home modifications or remediations. People living under a rental agreement, a lease agreement with a landlord are also eligible. The difference would be having landlord approval. You would have to have approval for these home modifications and remediation. Most of these would probably sit under the, Accessibility or American with Disabilities Act accessibility requirements, probably. I'm not well versed in that necessarily, but the idea is that your landlord really would want to approve these as well, and we hope that that won't be a barrier. Lance, that is a really good question about asthma and COPD, chronic obstructive pulmonary disorder, because I'm trying to stay away from acronyms, and I remembered that one. Mold and mildew removal, I do not know. I'm going to have to take that question back, and I will email Sean and the other facilitators of this group, and they can get back to you with that if that's okay. I'm not 100% sure on the relation with asthma and the mold and mildew. Oh, Susan, thanks. I see. Yes, much better or much easier to understand. Thank you so much. Absolutely. So if there's a child in the household, 1, 2, 3, 4, yes, that is sufficient enough. The member's guardian or parent would probably have to sign off and attest to that, but they do not need to be an Oregon Health Plan member. No. Okay, great. Yes, they can access those benefits through the kids. Okay, I think I addressed all the questions in the chat, so let's go to the next slide, please. And Sean, please tell me when I'm running out of time, because I can talk for a really long time.
Sounds good. We're doing good.
Thank you. So this is the eligibility framework that is relatively simplified. There's a lot going on here. And that's why reaching out to the coordinated care organization to do this screening when you know a few things are in the member's favor for this benefit is probably the wisest thing to do. But we do have resources where you can go through the eligibility framework. But we've talked about a couple of these. So the person must be currently housed, because this is not, this is to prevent homelessness is the idea, prevent eviction. And it's not for people currently unhoused. They also need support staying housed. They would have to have a lease or a written agreement with their landlord. Oh, and I should be really clear on this one. This is for rent, utilities, assistance, storage fees, and tenancy services. So this is not for home modifications and remediations. This is because they would not necessarily have to have a written agreement with their landlord for home modifications, for instance, if they own their own home. So there's the difference there. But the next eligibility factor would be having an income that is 30% or less than the AMI or area median income in their region. There, we use the Department of Housing and Urban Development, and there's a table online. We also have it in our resources where you can pick the city or the county or the region. It goes by different areas, and then look over at the household size and then figure out the income. 30% AMI is actually very low for someone in Albany. In a one-person household, I think it's $17,000 a year. So to qualify for this, you do have to be pretty low income there. The other piece is lacking sufficient resources or support networks to prevent homelessness. That would be in member self-attestation. No, I really need this help. My parents aren't paying my rent, or something like that, right? Or I don't have a family member paying my rent. And then they do need to have a housing clinical risk factor. Those clinical risk factors, though, it's very broad. It's not intended to be one of the limiting factors. It's a few things that I like to call out right off the top. It's anyone under 6 years old. And then, of course, the parents or guardian, or who they live with, would be getting support with that. Anyone 65 years or older, anyone pregnant or postpartum within the last 12 months. Those are the type of clinical risk factors that they look for. There also are other things like chronic physical, complex physical disorders or disease. There's behavioral health. There's a pretty big, long list there. But those are a few that are pretty simple, you know, the very young, the very old, or the pregnant or postpartum folks. So you can kind of look at that and say, okay, that's a decently sized group there, right? I want to answer Leah's question in the chat. It's extremely important. The question is, folks cannot be staying with family and friends to be considered housed, correct? And actually they can. So if people are, we have taken the department, or HUD, so the Department of Housing and Urban Development's definition, and kind of tweaked it a little bit here. So if someone is what people like to call couch surfing, they absolutely can get help paying the owner of that house for the rent. A lot of times they still need to have that written agreement, but we have also posted, or it might not be posted yet, but it will be, a simplified agreement that covers all the details between a family and a friend, or friends that are staying, relatives, etc. That it's a really simplified agreement that someone can look at and sign, and then use that as their written lease agreement with their landlord. Yep. Wonderful. Okay, thank you. Next slide. Oh, I've already talked about this. This is just a nice list for you to look at. I'm not going to go over it. We can go over to the next slide. You're not going to be able to remember all of these things, so having some reference slides is probably better than me speaking at you too much. And these are some examples of eligible populations. So it's a lot easier to understand things when you go through scenarios. So let's say you have, I'm going to make up a name too, Louise. Has the complex behavioral health condition. So maybe it's an active substance use disorder along with a mental health concern. Maybe it's schizophrenia. I'm just making things up here. Is behind on rent because they lost their job. That would be someone that really potentially could get the 6 months full of rental assistance, or just a couple months until they have gotten a new job, for instance. You could have people that lose their job. Not everybody has a job that holds their income, or is able to provide income through a disability, whether it's short-term or long-term as well. So let's say a complex behavioral health condition as well, or they broke their leg and they actually lose their job because of that. They could definitely be eligible for rental assistance. There is one here that addresses the last question, which is great. That doubled up. They can absolutely receive rental assistance to support that family that they're staying with, or the friend, whoever it is. One of the easier ones is a 5-year-old with special health care needs needing rental assistance. Maybe the parent took time off work, so that's a really good example of one where the child is a young person, it's a minor, they're benefiting from this benefit, but the parent and guardian is as well to make sure and support that child as well. And I skipped the last one, or the fourth one, just because it's a little bit more difficult to talk about. So let's say a family is at risk of eviction because of the lack of upkeep of their home, and they need chore services. So that could be something where you have a hoarding disorder, you have someone that is unable to physically clean their house and doesn't have the money to afford house cleaning services, right? I mean, most of us can't afford regular housekeeping services either. If you had a disability that you weren't able to actually take care of the home and it's becoming unsafe or unhealthy, then those are situations where the family could receive these benefits. It still has to be tied to that individual Oregon Health Plan member, but we recognize that families will receive the benefit of some of these services. And then, of course, that could be, they could also receive rental assistance. Not of course, I just want to comment, they could receive rental assistance and home remediation. It might not be at the same time, but they could be eligible for multiple benefits of these as well. They also could get housing sustaining services. So maybe someone could help them find supports where they could upkeep their home to prevent eviction in the future as well. So these can actually align and move along with each other to really support the member. Okay. So that was really it for my presentation. These are some key points here that I talked about. I'm not going to reread them. The only one I will say is that these benefit applications could take a little while. So we do have requirements for our health plans to process requests within 14 days for rent and for tenancy services, which could include utilities and storage. So they would have 14 days unless they need an extension. There's a possibility for that. So those ones could move a little bit more quickly from the time that they receive the request to the time they say this is approved or denied. For home mods and remediations, it's a little bit more difficult because you're depending on a supply chain, on a contractor, on the availability of other folks in the region. So the timeline is a little less strict on that. The idea and what is written in the Oregon Administrative Rules, or OARs, that is, excuse me, that is that people are served as expeditiously or as quickly as their circumstances require within 14 days is that's what it looks like. So just to be clear, this is not necessarily intended as like rapid eviction either. If they can process, like let's say someone gets a 10-day notice, they're eligible for the benefit. If the health plan can process that quickly and get that rent payment out, then that's absolutely a possibility for this benefit, but that could be really difficult just knowing how our systems are set up. So it's not as intended to be sort of that rapid eviction as it is more preventative eviction. So, okay. I want to look at the question in the chat. How is income determined? With a member that recently lost income or job, how far back is income verified? That's a really good question. I don't know the answer to that. I'm not the housing sort of analyst expert here. So I'm going to take that along with the asthma versus mildew removal. In fact, I'm copying it right now and make sure I get that to the facilitators here and get your questions answered. Those are very good questions. The last piece here, I kind of talked about outreach and engagement a little bit earlier, and this is for your reference more than anything, and to reach out. And like I said, I'll put my email in the chat. But this outreach and engagement benefit is really intended to invest in community-based organizations. It is hopefully to provide funds that can lead to sustainability so people can provide culturally specific, culturally responsive care towards the members, to the Oregon Health Plan members that they serve, connect members to these resources. It could be connecting them to the housing benefit, for instance, but it also could connect to things like legal aid, peer support specialists, and other services that a member may need. All right, I think that is it. What questions can I answer for you if there are any further ones? Okay, awesome. I will put my email in the chat, like I said, like 4 times. I don't know why I have to say it so many times, but there it is. And just want to make sure that I follow through on my promises, I think. And then you can see the provider trainings and resources here. So there will be a lot of new resources coming up in the next few weeks, and I'll get them to the facilitators of this group as well. Also, we will be attending a lot of the community partner and outreach program collaboratives that are county specific, and I think one is statewide for Spanish. We will be attending a lot of those and providing some resources too. So thank you very much.
Thanks so much for being here, Trisha. Appreciate you having me. Okay, and then I'm handing over to Katie Waldo for the OHP Bridge team to start off.
Hi, everyone. Thanks, Sean. Hi, everyone. My name is Katie Waldo. I use she, her pronouns, and I am the lead project manager for OHP Bridge. And we're here today to give our usual update and also provide some answers to some partner inquiries we received earlier this month. I think we can go ahead to the next slide. Yeah, there we go. Okay, so for those of you who may not have heard of OHP Bridge before or are learning about it right now, OHP Bridge is a new benefit for adults with higher incomes. And in order to receive OHP Bridge, you need to have an income no higher than 200% of the federal poverty level, be between the ages of 19 and 64 years old, not have access to another form of affordable health insurance. So this is an area where OHP Bridge differs a little bit from a majority of other forms of OHP. And you have to have an eligible citizenship or immigration status to qualify. The benefits for OHP Plus or OHP Bridge are very similar to OHP Plus, and it is a free coverage option. So there's no member costs such as copays or deductibles. Okay. So one of the things that we do like to clarify for everybody is that we do have two OHP Bridge programs that offer the same benefit. So OHP Bridge is the overarching benefit package. And then beneath that, we have two programs that deliver it. So the first is OHP Bridge Basic Health Program. This serves a majority of our members, as we'll see in a moment. It's managed exclusively by CCOs, so there's no option for open card, and that's just part of the federal regulations that governs the basic health program. We also have OHP Bridge Basic Medicaid, which is our smaller program, which was created in order to preserve the right that American Indian and Alaska Native individuals have to choose between CCO and open card coverage. So this serves a much smaller population, but it serves a very important purpose. So just to clarify, in case you hear those two different names and wonder what the difference is. So just to kind of to visualize what we were just talking about. So as of October 1st, we do have about 29,000 members on this program. A little over 28,000 of those members are on OHP Bridge Basic Health Program. So again, that's the one that's serving the majority of our members and is only offered through CCOs. A little over 800 people are currently on OHP Bridge Basic Medicaid. So again, those are American Indian and Alaska Native members who get that, who have the right to that decision between CCO and open card coverage. Move on to the next slide. So when we launched OHP Bridge in over the summer, we knew that people were going to be moving on from three predominant populations. So the first is individuals who moved over from the Oregon Health Plan. A majority of those folks initially have been from our temporary Medicaid expansion, which was in place over during the public health emergency. So in July, we had roughly 22,000 people move over at launch. We also have people that were previously uninsured that can now enroll in this program. So we're really excited to see those folks get coverage. And then we also have people that are going to be slowly moving over from our marketplace plans. So we have started to see that a little bit, but we assume that a majority of this population will begin moving over during open enrollment starting here soon. And so that's a population that's going to move over a little bit more slowly over the next several years. But we have started to see some numbers come from that population. So I think I'm handling this one, Sean. So just highlighting that we do have some trainings available for community partners that are really helpful. And so the first is just our general partner training. This provides a really good foundation in the program. If you haven't already taken it, we highly encourage you to do so, especially with open enrollment coming up here and starting in November 1st. So we have it available both in English and Spanish at the links on the screen. And I think this slide deck goes out after this presentation. So, and they take about an hour to an hour and a half to complete.
Alrighty. Otherwise, coming up on November 1st, besides the start of open enrollment season, is a change to immigration eligibility policy for both OHP Bridge and the marketplace. As I'll get to more on the next slide, this is all tentative information at this time. We'll discuss that on the next slide here. But if this change goes forward, then there are going to be new groups of people who are eligible for both OHP Bridge and marketplace financial assistance, which is people who have the DACA, Deferred Action for Childhood Arrivals status, as well as people who have applied for asylum and their claim is pending, as well as a few other types of employment authorization that did not previously qualify. So that's great news. It's estimated to be more than 7,500 people in the state that are one of those statuses. So it's a decent chunk of people that we want to get this new option out to. Though we've got some contingencies on the next slide here. Before I get into that, though, I do want to remind you that this is not replacing Healthier Oregon or affecting that. OHP Plus gives eligibility is regardless of immigration status for OHP plus. This is specific to OHP Bridge for our OHP purposes, and then the marketplace financial assistance is affected on their side as well. So this is beyond just Oregon, it's also a federal change. We do not know for sure whether it's going to go into effect, though. The current plan is to implement whether or not, if we don't hear anything, both us and the federal government will make on November 1st, the status is eligible for the new programs. However, there is a court case that is going to be heard at the earliest on October 15th, where we might get more information about if it's being delayed, blocked, put on hold. We don't know exactly what's going to be the outcome there. Sometime after October 15th, as soon as we have any certainty out of that, we're not sure it's going to be on the 15th proper. That's when the first hearing is. We will provide some additional communications. If it's going forward, we're going to roll out a whole instructional guide on how to enter DACA status into the one system. There would be some changes there if we're going forward with that. So in the second half of this month, we're going to be on the lookout for communications from us, essentially. We'll do a whole press release in the full 9 yards if it's going forward. If it's not going forward and things are staying as is, that situation depends heavily on what the court exactly decided, and we'll provide some communication and a status update there if it's not going forward. So if you're interested in tracking the updates, there's a link to the Kansas versus United States case there. There are also some additional court cases out there that are hearing challenges against DACA generally. So we will keep you updated, but otherwise we wanted to provide this forewarning that there is going to be an expansion on November 1st, and you should check in on the second half of this month for updates on what exactly is happening there after this court cases get heard. But with any luck, we will have 7,600 more people eligible for coverage. So that'll be great news. Otherwise, we are heading into the open enrollment season where people are going to be updating their marketplace applications frequently. We just wanted to revisit some of the slides from the community partner training here about transitioning from OHP Bridge or from Marketplace to OHP Bridge. So in short, people are not necessarily going to be required to move from Marketplace over to OHP Bridge, but updating their application at all can trigger being referred over to OHP Bridge. So if they don't have any changes and have agreed to auto re-enroll in the next plan year, and then they'll be able to keep their coverage for both 25 and 2026 potentially. Updates are basically anything, changing contact information, family size, income, all count as updates to their information that could potentially get them referred over to OHP Bridge. Just selecting to auto enroll does not. So that does not mean that you can intentionally not report changes to the marketplace. You are still required to report updates as usual. If you don't report updates, you can lose your financial assistance based on that. So it's still important to report updates. But if nothing changes, and you have a stable income and whatnot, and are able to keep going, that is an acceptable outcome here. Once you've been referred over to OHP Bridge, the marketplace is not going to terminate coverage automatically for anyone approved for OHP Bridge. So there's going to be a member step there where after you've been approved, we want them to go back and talk to the marketplace to make sure they cancel their plans and not end up with overlapping coverage going forward. We're planning some additional materials that are rolling out in November about the open enrollment transition or the marketplace transition and whatnot to better speak to this group. So be on the lookout for more in our next meeting about these things. Another common point of confusion that's been coming up has been about OHP Bridge start dates. As it turns out, there's also been an error in the one system displaying those dates wrong. So on the right side of the screen, you can see an example of what I'm talking about. The one system has been displaying the OHP plus logic where application benefits usually go back to the first of the month you applied in. That has been incorrectly displaying for OHP Bridge rather than the OHP Bridge BHP's future start dates. There's a fix scheduled in October. It's either going to be on the 16th or 30th that will get this resolved. So it's upcoming quite soon. We will have this fixed. And just to clarify, this only affects the one system dashboard, not the notices or any of the other display dates. So hopefully we'll have that addressed shortly. And as a general reminder on the start dates, this has been a common point of confusion. We've met both partners, staff, whatnot across the board. OHP Bridge BHP always has future effective start dates following basically the same rules as the marketplace. So if you're applying before the 15th of a calendar month, you get benefits on the 1st of the following month. So if you're in that first half of November, you're going to start on the 1st of December. If the decision is made in the second half of November, though, you would end up with a January 1st start date, skipping the month, going to the next one. We've got graphics for both of these both programs' timelines in our OHP Bridge toolkit. Those graphics are repeated on these slides here. So if you're in that orange part of the month, you would start on the orange date in November. If you're in the purple part of the month, you would start in December instead, based on when your decision is made. In contrast, OHP Bridge Basic Medicaid follows the same rules as the rest of OHP, where coverage can go backwards up to 3 months if you had medical bills in those months, and goes back to the first of the month you apply in. Otherwise, we're also rolling out some new OHP Bridge materials at the beginning of this month. They are currently in the queue to be posted, so this might have happened in the background while we're presenting. Otherwise, they're going to be up at some point this week, where we have the flyers and rack cards available in 14 languages, as well as social posts in 7 languages. That'll all be available via ohp.oregon.gov/bridge. And then we're going to have a limited run of English, Spanish flyers printed as well. You can request those through your regional outreach coordinator, and then we'll be doing distribution at the end of the month. So if you're interested in those, please reach out. And I'll hand it back over to Kitty for this.
Thank you, Sean. So one major sort of community outreach and engagement opportunity that we wanted to flag for you all is that we are launching the OHP Bridge Advisory Committee actually this month, next week. So the purpose of this committee is to provide recommendations for the program and guide trust fund management, as well as member outreach and communication. That's going to be a really key component. And we want to create an avenue where the state can report back to the community on key important features that we're doing related to the benefit and to our discussions with CMS. And to really provide a space for our community partners and community members, as well as our OHP Bridge members, to discuss with the state things that are important to them and sort of influence and help guide this new benefit package. We do really want to highlight that the OBAC is not a decision-making body. This will be a recommendation-only committee. And it will include sort of a broad range of representation. So we've listed the seats out here on the screen. We do want to highlight that we have 2 OHP Bridge member seats. These are people that are going to be representing members and are either considered eligible and have a future effective date, or they are actively receiving benefits through OHP Bridge. And this was a really key set of seats for us. So we're excited to have them on board. We also will have providers from a variety of settings and a couple healthcare organizations represented as well in order to represent those key partners. So we're really excited with the people that have been selected and to kick this off next week. Okay. So we did formally announce the OBAC members earlier this week. You can find it at the website, which is also listed here on the screen. We have it in both English and Spanish. We will, if you want more information, please check that out. We'll continue to update that with the more information on the members and the meetings. We'll be posting materials there, as well as links to the meetings. They will be public meetings, so you'll be able to attend, and they will have a public comment period at the end.
All right, let's get into some questions, and then we'll take the ones from the chat. It looks like we've got some gathering there.
Perfect. All right, so just a reminder to everyone who is, again, maybe attending for the first time today, we take questions from our community partners and assisters throughout the month, and we collate those and then present them here. So there's a couple of different ways you can submit questions if you would like to do so. You can do that through your community partner outreach program regional outreach coordinators, and they will send those questions along to us. You can also submit them via the OHP Bridge email, and that's listed here on the screen. When you register for this series, it provides a box for you to submit questions. You can go ahead and drop your questions in that box and it will send it along to us. You can also simply attend the office hours and ask your question in real time. As I said, we collate the questions we receive in writing each month. And then we bring together a group of policy and eligibility and communications analysts and type out some answers, and then we present them here. We do try to get those responses sent out to the original inquirers following the office hours, but the best and fastest way to get them is simply to attend this event. So our first question here is regarding a client who is over the age of 65, but is within the income range for Bridge and whether or not and how they apply. So as we've kind of discussed earlier, this program is for individuals between the ages of 19 and 64. So when you turn 65, your eligibility for OHP Bridge ends because you become eligible for other state programs. So with that in mind, we do want to also highlight that there is no specific application for OHP Bridge. You apply for Oregon Health Plan benefits through the one online portal in the same way that you would for any other, for say traditional OHP, or you can do it over the phone via paper application with, through an assistor. And the one system will then analyze your application for all the available medical assistance programs, including Bridge. So it'll run through a hierarchy of programs and find the best benefit package for you. I think I'm handing it over to you, Sean, for this one.
Sure. Yeah, this one was just an expansion of the previous question asking about the income verification for Social Security income or a family trust. In general, you're not always going to be required to provide verification. There are times when the rules do not require it. And then the one system's also going to try to verify your income and other factors based on federal data sources that the system has access to. So if we do require verification, for instance, the automatic verification check doesn't work, then they will receive a notice in the mail explaining what they need. That'll provide specific examples that are relevant to the type of income that we failed to verify. So it's going to give you a very specific list for each of these. Though a couple of examples that would work, though, for Social Security, a benefit statement or award letters, a common one, or for the family trust, some sort of tax document from the trust, or just a written statement or documents that verify the amount, source, and frequency. We also got a question about whether the income limits when we're quoting 138 to 200, whether those numbers are inclusive of the whole 200 or 138 number. The shorter answer there is that the 138 number gets released by the federal government each year and then rounded up to the nearest dollar. And then that is the hard limit for OHP. So anything above that dollar amount would render them ineligible for OHP Plus and into the Bridge group if they're at 138.0001. Same goes as once you go over 200, it's going to be inclusive of the dollar that gets you into the 200 amount, but $1 over that, it would not. So at 200.1 or whatever that comes out to, it's really based on that hard dollar limit there. Hopefully that answers that question. I did also want to acknowledge we got some other questions about annual income and monthly income questions that we'll be addressing next month when we have a little bit more time to respond. So other than that, that moves us into open question and answer. I am unable to see the chat. Can someone help out by reading through the questions we've received on OHP Bridge or any other topic?
Well, here's an easy one that Susan asked at the end here is what's the link where we can find old videos of this?
We can get the link to the office hour page dropped in the chat shortly.
Right.
I'm going to stop my screen share so I can do that.
Oh. No, if there was any other Bridge questions in the chat, but I would love to be corrected. Must they file taxes to qualify for Bridge?
How are they able to keep their important doctors when they are changed to Bridge? That's going to be dependent on the network that they have available to them, whether or not they're able to. So if someone gets moved from a marketplace plan to OHP Bridge, for instance, if they're on OHP Bridge, like the majority of the members, they are going to be enrolled in a CCO, and that CCO's network is going to determine their provider network. If that provider is not contracted with OHP at all, we can't require them to. It is up to the provider's willingness on some level. Though if they do contract with OHP at all, and it's just a different CCO or something like that, there are other tools that are probably pretty feasible. Providers can create single case agreements just to pay for a single client's case, though again, it's all very situational, willingness of the provider dependent. Contacting the CCO and asking for a care coordinator is one of the better moves to get some help with that sort of thing if you're having a specific access need there or network adequacy concern or something like that. Hopefully that addresses the question.
And Sean, there's subsequent questions about filing taxes for Bridge. Must they file taxes to be eligible?
Tim, are you on the line and able to take this one? Otherwise, we're going to take that back one and confirm. At least for the marketplace, you're required to file taxes in order to claim tax credits for future years. I would like to confirm how the One System is treating that. Oh, looks like Tim's waiting in.
Sorry, I was double muted, so I wasn't able to get through. But no, you do not have to file taxes. What Sean said is right regarding the marketplace rules, but for OHP Bridge, for a basic health program, you do not have to be a tax filer in order to qualify. And I would not be able to walk through the level of detail as to how the calculations are different, but there is in our rules, there's the separate explanation as to how the household sizing groups, how the edge groups work for non-filers, but there is a process and the One System is set up to handle that when somebody is not a tax filer.
I just dropped the link to the office hours page in the chat. We are a couple months behind on posting those. We don't have last month's up yet due to some concerns with spreading the Snap content out a little bit farther than we wanted to initially, but that is good to go. So we'll have that coming soon. So our apologies for the delay there. We will let you know when that's posted. I'm not seeing any other questions in the chat right now. Anyone else have any topics they'd like to discuss? Otherwise, we'll wrap it up here. Looks like we're a little bit over time.
We are indeed. So I imagine we've lost a few people, so we will see you again next month.
Thanks, everyone.